I want to talk about this responsibility thing because what we tend to do is we tend to hold everybody accountable. When I say we, I'm talking about the people living in the HIV community, and I'm generalizing, but this is my experience. We tend to hold governments accountable, we tend to hold and responsible, we tend to hold businesses, we tend to hold everything except the individual. And I'm reaching a point 26 years into this disease, of working, living, loving, and playing in the area of HIV/AIDS as I have. I'm getting to a point where I'm actually tired of it. I'm tired of people not taking responsibility for the actions that they take. For 20 something odd years, I was a smoker. And if I was to stand up in front of a crowd of people and say, my name's David Patient and I am a person who has lung cancer, how much sympathy am I going to get? How much support am I going to get? How many people are going to rush up and throw their arms around me and say, you poor, poor thing, you, oh my Lord? Chances are that's not going to happen. And why? Because it was a lifestyle choice. Well, largely nowadays, HIV, I feel, is a lifestyle choice, with the exception, of course, of people who are forced into a sexual act against their will, including women who are disempowered, and, of course, children who are infected mother-to-child transmission. Essentially, people who are raped and children. Anybody else essentially has made a conscious choice not to listen, not to follow the rules, and that, I know I'm making some very broad sweeping statements here. We need to start thinking about HIV from a way bigger picture, and we're not. We're looking at it from these little 2-year intervals. We need to start thinking about HIV for the next 30 years, the next 50 years, etc., and start realizing that the behavior change that we're so dying to see, no pun intended, are things that are going to take 1, 2, maybe 3 generations. And if we don't start sowing those seeds now, we are simply going to be bumping up the process. And we need to get to a point where that actually stops. We need to start having some incredibly courageous conversations with people. We need to challenge things that we know as detrimental behavior and not say that they are wrong. Point out to people that those are the choices that they are making. If you choose to have multiple partners, then clearly understand that you are running a risk. And if you become HIV positive because you chose not to use condoms within those concurrent relationships that you're having, then you need to take responsibility for that. And don't make a decision, a lifestyle choice and decision that you have made, once again, with the exceptions of the people that I mentioned before, because I don't want anyone coming down on me. We need to start saying to people, you've made a decision, and now you need to live with the consequences of those decisions. Am I saying we don't help them? Am I saying we don't support them? Absolutely not. That's not what I'm saying. What I am saying is that until such time as we start holding people accountable, they are going to keep behaving the way that they behave. And for the last 20, almost 30 years now in HIV, nothing has really changed. We've learned a whole bunch. We've come up with a whole bunch of conclusions and stuff. We obviously understand the disease and the body and all those other things. But when it comes to behavior change and the things that we really know are going to change and motivate generations from now, so that we can look at HIV as a short pandemic versus a long-term pandemic, which the majority of pandemics tend to be, with the exception of the swine flu. The average one lasts on a couple of 100 years. So we need to start thinking in terms of that. I think in our arrogance and in our desire to make the world seem like we could have control over this thing, we said, okay, we'll have a cure in 5 years. Well, I've been listening to that now for, what, this is about the 5th time I've heard it, if you count it every 5 years. It ain't happening. And yes, HIV is a very manageable disease. It's a chronic disease. We can live with it. We can live long, normal, healthy, productive lives. I know all of that. I'm one of those people. The point I'm trying to get to is that in terms of our HIV messaging, in terms of the way we treat people living with HIV, in the way we treat people who choose to not come forward and get tested, the way we treat people who choose not to get on treatment, we need to honor those choices. As long as we can consciously say that we have done everything within our power to expand their conscious choice, even if that means having very difficult conversations with people, holding a mirror up to them and saying, well, hang on a second, you're saying this, but you're doing this. I'm as guilty of it as the next person is. I just think that we need to start having different conversations, more courageous conversations. And this dialogue has got to happen at some point soon if we ever hope we're going to make any kind of impact on this disease.